Award. 2020 presented some of the biggest, most unprecedented challenges that individuals and businesses alike had to face. In the midst of everything happening in 2020, our healthcare professionals were thrown into something that is unimaginable to many of us and that work outside of that field. There is nobody more worthy to receive the Heroes Among Us Award than the staff at Sydney Regional Medical Center. The entire SRMC staff, from maintenance to surgery, had to adapt to ever changing protocols and policies, all while still maintaining the highest level of care they could provide to patients and families, and while still wearing those pesky masks. Thank you for your diligent work and caring hearts throughout the pandemic. The families of all the people that have been treated by SRMC can't even begin to express their gratitude. And with that, I present to you the Heroes Among Us Award, the staff at Sydney Regional Medical Center. So since Brad was last to the stage, does he speak? Yes. Okay.
I am going to wrote something. Okay. I wrote something down because I didn't want to forget anything and I didn't want to cry. So, my name's Annie McCartney. I'm the Director of Nursing at Sydney Regional Medical Center. I am here with my Assistant Director, Sherry Makey, and joining me on stage are all the representatives of each department who made it possible for us to provide care to our patients during this pandemic, and we would not have been successful without each other. It's an honor to receive a recognition such as this from patients and their families because it lets our staff know that we are making a difference. We remember our patients, we remember their families, and we remember each phone call and conversation and feel the weight of both responsibility and privilege as we care for each patient. Our hope is that amid all the uncertainty, we may still provide the human connection that patients need to help them through what may be the most challenging time of their life. Together with our physician colleagues, exceptional ancillary care teams, and support staff, we were able to respond to the COVID pandemic in a way that met federal guidelines but allowed us to preserve our small hospital personal touch. It was important to our staff to let patients know that even during a pandemic, they were not a number or just a diagnosis. This award is an honor to receive, a testament to the work that is being done, and an inspiration to the work that we have left to do. Thank you.
Okay, I have something small just to follow up what Annie said. So as she said, I'm her assistant director, but I'm also a staff nurse. So I did get to work the floor quite a bit during the pandemic. So first of all, thank you for recognizing all of us. That's awesome, and it means so much. But as I recap on this past year, I think of all the appreciation we received on the front lines. It came only not from our admin team, the fellow ancillaries departments, but the community as well. Along with this appreciation came a tremendous amount of trust. In times of illness, this is not only stressful for the patients, but it's equally stressful for families. And unfortunately, due to the level of contagiousness of COVID, you guys were all aware the hospital had to be locked down. Families in their forced absence, as well as our patients, trusted we would do everything in our power to heal. And if healing were no longer an option, then they trusted that we would provide the compassion and comfort during the final hours and minutes of life. In a community as small as Sydney, our patients are not just a name or diagnosis, as Annie said, but you guys are our neighbors, our friends, and our families. Nurses and healthcare workers are born to care, and we've done just that. Not every day was easy, but because of the enormous amount of trust and appreciation that we received during this trying time, we've prevailed, and we will continue to do that as a healthcare team. So once again, thank you for the amazing recognition, and thank you for putting your trust in us.